Hives, medically known as urticaria, is a common skin condition characterized by the sudden appearance of itchy, raised welts or bumps on the skin. These welts can vary in size and shape and often appear as red or skin-colored patches. The condition can be acute, lasting less than 6 weeks, or chronic, persisting for more than 6 weeks, affecting millions worldwide. What are hives? Hives are caused by an allergic reaction or immune system response that triggers the release of histamine and other chemicals from mast cells in the skin. This release causes tiny blood vessels to leak fluid into surrounding tissues, resulting in swelling, redness, and itching. The welts or wheals typically appear suddenly and may fade within hours or last up to a day before disappearing and sometimes reappearing in other areas. Causes of hives, urticaria. Hives can result from many triggers, though sometimes the cause remains unknown. Idiopathic urticaria. Common causes include allergic reactions, the most frequent cause, including allergies to foods, nuts, shellfish, eggs, medications, antibiotics, aspirin, insect bites or stings, and latex. Infections, viral infections such as the common cold, hepatitis, or bacterial infections can trigger hives. Physical triggers, pressure on the skin, cold, heat, sun exposure, water, exercise, or vibration can cause physical urticaria. Stress, emotional stress can exacerbate or trigger hives in some individuals. Chronic conditions, autoimmune disorders or thyroid disease can sometimes cause chronic hives. Other triggers, exposure to certain chemicals, plants, or contact allergens. Symptoms of hives. The hallmark symptom of urticaria is the presence of welts or wheals on the skin. These typically have the following characteristics. Appearance, raised, red or skin-colored bumps or plaques with well-defined edges. Size and shape, vary from small dots to large patches, often round or oval but can merge into larger areas. Itching, intense itching is common and can be accompanied by a burning or stinging sensation. Duration, individual welts usually last less than 24 hours but can recur in new areas. Swelling, angioedema in some cases, swelling occurs deeper in the skin, affecting lips, eyelids, hands, feet, or throat. Angioedema can be painful and dangerous if it restricts breathing. Types of urticaria. Acute urticaria, lasts less than 6 weeks, usually linked to an allergic reaction or infection. Chronic urticaria, persists longer than 6 weeks, often without a clear cause, and may fluctuate in severity. Physical urticaria, triggered by physical factors such as pressure, cold, heat, sunlight, or exercise. Cholinergic urticaria, caused by a rise in body temperature due to exercise, heat, or emotional stress. Contact urticaria, caused by direct skin contact with allergens or irritants. Diagnosis. Diagnosis is mainly clinical, based on the history and physical examination. Key steps include medical history, detailed history of symptom onset, triggers, duration, and associated symptoms. Physical examination, observation of typical wheals and swelling. Allergy testing, skin prick tests or blood tests may identify specific allergens. Blood tests, to rule out infections, autoimmune diseases, or thyroid dysfunction. Challenge tests, sometimes used in physical urticaria to reproduce symptoms under controlled conditions. Skin biopsy, rarely needed, done if diagnosis is unclear or to rule out other conditions. Treatment of hives. The main goal of treatment is symptom relief and identifying or avoiding triggers. Treatments include antihistamines, the first line of treatment. Non-sedating antihistamines, example ketorolac, loratadine, block histamine receptors and reduce itching and swelling. H2 blockers, sometimes used alongside antihistamines for additional relief. Corticosteroids, short courses of oral corticosteroids may be prescribed for severe or persistent cases but are not recommended for long-term use due to side effects. Epinephrine, used in cases of severe allergic reactions, anaphylaxis, involving hives and angioedema. Immunosuppressants, for chronic urticaria unresponsive to antihistamines, drugs like cyclosporin or omalizumab, a monoclonal antibody, may be used. Avoidance, identifying and avoiding known triggers such as certain foods, medications, or environmental factors is crucial. Lifestyle measures, wearing loose clothing, avoiding heat or sweating, and stress management can help reduce flare UPS. Prognosis and complications. Acute urticaria often resolves without complications. Chronic urticaria can significantly impact quality of life due to recurrent symptoms, sleep disturbance, and psychological stress. Rarely, hives can be part of a more severe allergic reaction involving airway swelling, angioedema, which requires immediate medical attention. Persistent hives may sometimes signal underlying autoimmune or systemic diseases, requiring thorough evaluation. Prevention. Avoid known triggers. If allergens or irritants are identified, strict avoidance is key. Medication caution. Inform healthcare providers of any drug allergies. Stress management. Techniques like yoga, meditation, or counseling may help reduce outbreaks. Skincare. Use gentle, fragrance-free skin products and avoid harsh soaps or hot water. Protective measures. For physical urticaria, protective clothing or barrier creams may help. Conclusion. Hives, urticaria, is a common but often distressing skin condition caused by an allergic or immune response that leads to itchy, swollen, red welts. While usually not serious, hives can be a sign of an allergic reaction that requires urgent care. Understanding triggers, early diagnosis, and appropriate treatment are essential to managing symptoms effectively and improving quality of life. For chronic or recurrent cases, a specialist such as a dermatologist or allergist may be needed for comprehensive care.